where actually the whole idea of this artificial intelligence is to support the doctor to provide the same efficacy when you do the first procedure, the first follicular unit hair transplant and the last follicular unit hair transplant. It's commonly accepted nowadays the most efficient procedure to do a hair transplant is called a FUE, where you actually take a single hair follicle, you harvest it and you implant it on the scalp. Now, where does artificial intelligence come in helping us is, even if you're an experienced hair transplant surgeon, it requires a long skill to come to an expertise level, maybe like 10 years and few hundreds of procedures. You should know which unit is the ideal unit to take from the back, and there is something called the transaction rate, where actually a single follicular unit will have other hair strands attached to it. It could be multi, 3, 4, etc. So we should not cut the hair in between while taking it out. So taking it properly without harming the hair follicle is a skill by itself. Second, to know the depth that you should penetrate ideally to take the graft out is again a skill that's developed. And besides all that, the third thing is harvesting and implanting it. That means to know which is the ideal site or recipient site to actually put the hair transplant so that it will give you a very natural look. It shouldn't be that hairs, if you notice, I mean, when you look at it, it looks like they're all growing in the same pattern, but then they all grow in different angles. So it should be placed in an angle such a way that it goes along the existing hair. It should not damage also the existing hair that's present on the patient's scalp. So the robot helps us in assessing which is the perfect site of incision, perfect site of putting it back, the donor area and the recipient area, the amount of pressure that's required to insert, the angle that's required, the density of existing hair follicles. So all these are skilled that is developed with years of practice. And of course, when you have a hair transplant surgery, it's usually done by a team. It's not possible to do it alone. So even when you are overviewing a procedure with the help of your assistants, it's impossible to pay attention to the 2000th graft that you're taking out than the first graft. So a robot will automatically give you the same result or the same action even in the 2000 implant as it did in the first implant. But a human being, there's a chance of fatigue getting involved. So this is where artificial intelligence is coming into play of hair transplant actually. It's more precise and it can be controlled and it is replicated completely the same way, which as a human sometimes it's impossible. Because the robot is going to be precise in, as you rightly mentioned, in the first procedure and the last procedure, the harvesting, donor, recipient, everything, exactly the way that we have planned the procedures. Now, I will never say it's come to the point where we are able to say that the robot is going to handle the procedure completely, because after you have taken the donor, follicular unit extraction, you need to dissect it and prepare it, and we need to actually prepare it and insert it back into the robot so that it identifies, incises and puts it into the recipient site with precision. So you are overlooking the procedure completely. It is not exactly in the hands of the robot. Robot is just suggesting to us that probably this angle, this site, this area is the best. They give us pretty choices, like 2-3 choices, and it's you who decided. And if it's still economically viable, I would say it's still not economically viable all over the world, because there is a disposable cost for per procedure. Also, you do still have to pay a royalty to the company for the amount of grafts that you have done. So in a normal scenario, if you look at the results of a very experienced hair transplant surgeon and a robot, actually the results probably vary about 5 to 10% alone. So when you're going to charge a patient so much difference, let's say a $5,000 difference, is the cost justified? I'm not very sure. I still think we do have a bit of a way to go about it, where we can say that we are completely dependent on the robot. So I would say it's convenient right now. It saves us time. If you're a busy hair transplant surgeon and you want to do something like 2,000 grafts in an implant and finish the entire procedure in 4 to 6 hours, it's possible with the robot. But you can still do the, let's say, this almost the same amount of precision if you take a little more time, like 7 to 8 hours, and almost give the same kind of results. So it's still a luxury treatment, I would say, but it's the future.